In today's video, we will be going over what Méniere's disease is. So, what is Méniere's disease? Well, Méniere's disease is the disorder that occurs in the inner ear and affects your balance and hearing. Some things to know about this disease are that it occurs in only one ear. However, there is a 15 to 25% chance of it affecting both ears. Also, it only affects individuals 18 years and older, but it commonly occurs in people 40 to 60 years old. Some symptoms of Ménière disease are vertigo, which is a spinning sensation that can cause nausea and loss of balance, and it can last anywhere from 20 minutes to several hours. Next, we have hearing loss, which fluctuates and may become permanent over time. Then we have tinnitus, which is a ringing or buzzing in the affected ear. And lastly is the feeling of fullness or pressure in the affected ear. Now, when it comes to the causes of Méniere's disease, there is no exact or official cause, meaning it is unknown why this disease occurs in individuals. However, some scientists believe that some causes are fluid buildup in the ear, constricted blood vessels, viral infection, allergies, or genetic factors. Therefore, because there is no official cause of this disease, the same will apply to diagnosis and treatment. Like mentioned, there is no official or specific test to diagnose an individual with Méniere's disease, so diagnosis is based on medical history and symptoms. Most providers will perform a physical and neurological exam to be sure and ask more about your symptoms. Other tests that your provider may order are hearing test, vestibular test, ECOG, an ENG, and an MRI scan to rule out any potential illnesses. Now, there is no official treatment, but some options doctors might give the patient are like medication to help the symptoms or if any pain occurs. So like diuretics, which help reduce buildup in the ear, or like corticosteroids, which help reduce inflammation, or beta-histine, which is a medication to reduce vertigo. There are also surgical options like endolymphatic sac surgery, vestibular nervous section, and cochlear implants. However, just note that these surgical options are known as a last resort option and are more for patients whose disease is more severe. Now, some important information the doctor might give would be doing changes to your lifestyle and how you manage your life. For example, dietary changes can help because a low sodium diet will help reduce fluid retention, and avoiding caffeine, alcohol, and nicotine is important since these can worsen your symptoms. Also, managing your stress is important, and doing physical therapy like vestibular rehabilitation, which helps with balance. Next, we have complementary therapy options like acupuncture, chiropractic, massages, meditation, osteopathy, pressure pulse treatment, reflexology, and yoga. Now note that complementary therapy is not considered an official or standard treatment in itself, and doctors might not recommend or discuss this option since evidence in this area is limited, and results and accuracy depends on the severity of the disease. Yet for some, these options either work for them or help manage their symptoms. Another important thing to know is that having emotional and psychological support is critical due to the impact the disease might have on a person's life. Therefore, support groups and counseling can help individuals cope with the anxiety or stress they might have with this disease. It's important to know that you are not alone and seeking for support is okay. And now, in conclusion, we learned that Méniere's disease is a complex and chronic condition that affects hearing and balance. Managing the symptoms of Méniere's disease can be done by lifestyle changes, medication, and surgical intervention. And early detection of Méniere's disease is important since it can help reduce the impact of the disease. Therefore, if you or anyone you know is suspected of having Méniere's disease or is experiencing any symptoms, contact your primary provider for a consultation as soon as possible.